How to clean an infected ear piercing. Infected ear piercings are common, especially in new piercings. Most go away after 1 to 2 weeks, as long as you clean them twice a day. Use a cotton ball or swab soaked in a saline solution or antimicrobial soap to clean the infection, then dry the area with a disposable paper towel. Avoid using alcohol and hydrogen peroxide, as these substances will interfere with healing. See your doctor if the infection spreads, if it doesn't improve within 2 days, or if you develop a fever. Always wash your hands before touching your piercings, and prevent reinfecting the area by avoiding swimming and sanitizing your cell phone. Cleaning an infected piercing at home. Wash your hands before touching the piercing. Always wash your hands well before touching a piercing, especially if it's new or infected. Use an antimicrobial soap and warm water. Avoid fiddling with your earrings and only touch them when you have to clean them. Do not remove a new ear piercing. If your piercing is new, keep it in place for at least 6 weeks, even if it becomes infected. While you should rotate a new lobe piercing, stop rotating it if it becomes infected for 1 to 2 weeks. If your infected piercing is permanent, or more than 6 months old, remove the earring while you deal with the infection. Clean the piercing with a cotton ball dipped in saline or soap. Soak a cotton ball or swab in saline solution or a mild antimicrobial soap. Dab the soaked ball or swab around the infected area. Then dry the area with disposable paper towels. If the shop where you got your ear pierced provided a saline solution, use it to clean your ears. You can also purchase a pre-made product or make a saline solution by mixing 2 teaspoons of salt with a quart about a liter of warm water. If you use a soap, go with a fragrance-free brand that doesn't contain alcohol. Clean an infected ear piercing twice a day. You can rotate the earrings during this time while they are still wet from the saline solution or soap. Apply an antibiotic ointment. After cleaning and drying the piercing, you can apply an antibacterial ointment to encourage healing. Dab a small amount of the ointment onto a cotton swab and paint a thin coating over the infected area. If the infection is weeping or emitting a discharge, avoid using ointment. 5. Avoid rubbing alcohol and hydrogen peroxide. Rubbing alcohol and hydrogen peroxide will dry out the infected area and kill cells that are needed for healing. Killing white blood cells around the infected site could make the infection even worse. Don't apply alcohol or hydrogen peroxide to the infection, and make sure any cleaning products you use are alcohol-free.